We've hooked up our vein system correctly. We have our fresh gas flow. We have our corrugated tubing. We have our rebreathing bag. Our pop-off valve is open, and we have our scavenger. To trace the flow of oxygen through the system, so the oxygen is going to come down here, along here, through that inner blue tubing to the patient, then out here through the outer tubing. So it's going to go in this corrugated tubing back all the way through here. Might go into our rebreathing bag for a while, and then out our pop-off valve and into our scavenger system. So this is a high flow system. So we use a high oxygen flow rate because we want to make sure that between breaths, the flow rate that's coming at the end here is high enough to keep on pushing out that exhaled gas. So we use very high flow rates of oxygen, a minimum of 200 mLs per kilo per minute, to keep on pushing the excess gas all the way down this way so that when our patient does take a breath in, it's all fresh gas at the top here. Okay, so now we have two ways to pressure check this system. One way is exactly like very similar to what we did before. I'm just going to hold my thumb over the end here. I'm going to close the pop-off valve, and I need to fill this bag. Before, it was okay for us to use the flush valve to fill this bag, but we don't want to ever use this flush valve when we're hooked up to this system. And the reason is we get a very high flow of oxygen right up at the end here, and if that's attached to a tiny endotracheal tube, that goes right down into the patient's lungs and can cause barotrauma. So I'm going to fill this up using my oxygen flow meter, not my O2 flush. So we'll just turn this on, about 1 liter per minute. I'm watching the pressure gauge over here now, and I'm just going to watch that till the bag gets bigger and we pressurize. So first the bag has to fill. Then once it's full, it will start to pressurize. You can see the needle going up. And again, we want to be somewhere between 20 and 30 centimeters of water. I've turned off my oxygen flow, and I'm just going to hold this for 30 seconds. So again, I'm watching for the development of any kind of slow leaks. Also, the pressure should not be getting any higher if your O2 flow meter is all the way off. Okay, so now I'm just going to open this and watch that pressure go down. So I've released pressure, again, testing to make sure my pop-off valve works, and also to make sure that when I'm done, I've left the pop-off valve in the open position, because we never want to leave this in the closed position. The second way that we can test, so that test there is going to check our outer tubing for leaks, our connections, our bag, to make sure all the integrity of the outer system is intact. A test of the inner tubing requires us to occlude that inner tubing. So we're just going to test that inner blue tubing. And the way we're going to do that is I'm going to turn on my O2 flow, say 2 liters per minute, between 1 and 2 liters per minute. And now I'm just going to take a pencil and occlude the end of that inner tube. And when I do that, I'm going to watch my flow meter, and I'm watching for a decrease in flow. Okay, so I'm going to occlude the end here, and you see how that little bobbin goes down and the alarm goes off. The alarm's kind of annoying, so we can turn that off for a moment. So I can do that again. I occlude that inner tubing, and you see that bobbin go down. So what that tells me is that I'm pressurizing the system all the way back here to our pressure gauges, and ultimately to the flow meter, causing that flow to go down because the pressure is building up, indicating that I don't have any large leaks. Okay, so that is the vein system on our newer machines. The machines that are a little bit older that you'll use in Surgery C next year, the vein system is a little bit different, and so let's go talk about that. Okay, so we want to talk about the vein system, which is a little bit older version of what we had. And so we have this machine right here, which is very similar to what we were just working on. And we have our circle breathing system would be over here, where we would hook up our rebreathing bag and our corrugated tubing. Well, we don't need to use that at all for this Bane system. We just have to figure out where we're going to hook it up. So the Bane system is going to hook up right here on this bracket. So this bracket right here is just on the block where our pop-off valve exists. And our adapter is a little bit different on these older Bane systems. It's essentially just a L-shaped piece with a place for our manometer on top. And you can see in the back there's the other side of the bracket. So this goes right on here. It has no relationship to any of this stuff, it's just that it's sitting there is all. Okay, the rebreathing bag is going to be different. So on the newer Banes, I use this bag that has no holes in it. On the older ones, this bag, which is a little bit smaller, has a hole in the side with a little covering and a diaphragm on it and a connector right here. This is going to hang right here. Okay, so this is our rebreathing bag. And we just kind of push it on there like that. Our corrugated tubing is going to come on here just like before. The end that has the inner tubing connection goes at the far end, and this is our patient end, and that connects right there. And just like before, we have to figure out where we're going to hook up our fresh gas. And so if we follow this fresh gas tubing, we'll find that place where we can pull it apart and connect our fresh gas inlet for our system. Okay, and then we have one more thing to do, which is to hook up our scavenger system. On this particular one, we're going to pull the scavenger off the back of this other pop-off valve because we're not using it. And it's going to come right down here and hook on down here. You'll notice that sometimes it'll start to twist the bag, and I want to make sure that bag hangs nice and straight so we don't get any problems with gas leaving the bag. Okay, so the direction of gas flow, or how gas flows through the system, is the same. We have our fresh gas coming here through that inner blue tubing all the way to the end, and then exhaling along here. There is no pop-off valve for this to go through. It's going to go into the bag, and once the bag starts to fill, it'll come out through here and on out that way. Okay? So out of the two pressure checks that we did, if we want to pressure check the inner tubing, that's exactly the same way that we did it before. So that doesn't change at all. What's a little bit different is when we do the pressure check of the outer tubing in the bag. Let me show you how that works. Since we don't have a pop-off valve to close, I've got to hold off the end right here. Okay, so I've got to hold off the end, and I can slide my finger through the side here, and I'm just trying to get on either side of this little adapter with the diaphragm. So if I can hold that off, and I have this end held off, now I'm going to turn on my action flow, and I'm going to fill up the bag somewhere between 20 and 30. Went over a little bit, but that's okay. And now I'm going to hold this for 30 seconds. So I'm just going to hold this, make sure that there's drop in pressure. My oxygen flow is off. The more I fill this up, the harder it is to hold. Sometimes we get little decreases, and that's hard to avoid. And so basically what we'll say is if we get 5 centimeters of water drop in 30 seconds, we'll accept that amount. After I'm done, I can just release the pressure there, and we're done with that pressure check. So this system has no pop-off valve that can be closed the entire way, because this pop-off valve isn't used at all. This is part of our circle breathing system. That's the biggest difference between the older Bane and our newer Bane. Okay. I think that is pretty much everything we want to cover today. We'll go over these machines in greater detail and give you a chance to get some hands-on with the machines during our recitations. Thank you.